Be here speaking to so many parents who have students all over our amazing county. As Mrs. Fullwood mentioned, my name is Jennifer Sparano. I am currently serving as COVID commander for Hillsborough County Public Schools. I have been an employee of Hillsborough County Public Schools since 1998. I am a transplant from New York. I began my teaching career in the Bronx, and I transferred to Florida, like I mentioned, in the summer of '98. I taught for 12 years. I began my administrative career at East Bay High School, where I served in 2 different capacities as assistant principal. And then I transferred to Tampa Bay Tech, where I served as assistant principal there. I was promoted to the principalship at Brandon High School in 2016. And then this past summer, the district asked me to take on this role. And so I am currently the COVID commander. And what that means is that I manage the district's response to COVID-19 in our schools and at our county, our Hillsborough County sites. If it's not a school, we have warehouses and maintenance locations. We also have ROSAP, which is where I'm at right now, and we have the ISC. We have a number of Hillsborough County sites. So I manage the response, and I have worked with a team of people to create procedures, and I'm going to share those with you. So I want to thank you for attending. I want you to know that every piece of our district's response hinges on the participation and advocacy of our school communities. And so as parents and families, that means you. So thank you very much for attending to learn more about the process, and thank you for being involved. So I don't do it by myself. Everybody on this slide is involved in the process. Obviously, parents and families are first and foremost, because without good communication from parents and families, we won't know that children are symptomatic or test positive. We wouldn't know that family members are symptomatic or test positive. We wouldn't be able to trace exposures to activities that happen outside of the school day. At each Hillsborough County school or building site, we have a COVID lead, which is often an administrator, and we also have student health personnel, our school nurses, that help in the process tremendously. We have a tremendous partnership with the Department of Health Hillsborough, and that consists of epidemiologists and investigators. They actually moved in to the office next door here about 6 weeks ago, I believe, and they are next door to us all day long, and we are able to connect with them and brainstorm around different problems and procedures that we have. The COVID team consists of myself. Again, I'm Jennifer Sparano. I work with an amazing registered nurse. Her name is Terry Kemp, and another former principal, Toinita Martinez, and she manages all of the data and documents that we collect around our COVID response. Also, I would be remiss if I did not mention our safety and risk management environmental cleaning team. They are on the ground every day, 7 days a week, responding to cleaning that needs to occur as a result of COVID. And we are all supported by Hillsborough County Public Schools district admin and staff. So the first thing as parents that we always want to know is, why did my child have to quarantine, or who needs to quarantine? So when we use the word quarantine, we are specifically talking about somebody who has been exposed to someone who has tested positive. So what does exposure mean? Students and staff who have been in close contact with someone who has COVID-19, excluding people who have had COVID-19 in the past 3 months. So anybody who was in close contact of a positive case would need to quarantine. People who have had COVID-19, who have had a positive test in the last 90 days, do not need to quarantine as long as they don't have symptoms. So I have, right now, the CDC and the Department of Health are not absolutely positive that people can't get COVID twice. So we use that symptomatic strategy just to make sure, as long as they don't have symptoms, they do not have to quarantine again. Some students and staff are also advised to quarantine by their doctor. even though they don't have a positive test or they haven't been exposed, their symptoms might be such that their doctor advises them to quarantine. And so, of course, we follow that medical advice. So what is a close contact? A close contact is somebody who was less than 6 feet of the positive person, of the infective person, for a cumulative total of 15 minutes or more over a 24-hour period. So let's think about classrooms. We know that in one day, our students are in, if it's high school, multiple classes. If it's elementary school, it's fewer classes, but middle school and high school, 7, 8 classes a day. And we know that those classes are longer than 15 minutes. So in one day, like from 7 a.m. this morning or 8:30 this morning until 3:30 this afternoon, our students met that time criteria. So then we have to decide, were they less than 6 feet from that positive adult or positive student? And if the answer is yes, they need to quarantine. Now, we back up 2 days before the onset of symptoms. So what that means is if a student starts having symptoms on Friday and then subsequently tests positive, we would back up to Wednesday, 48 hours before symptom onset, and any students that were in contact with that positive student 48 hours before their symptom onset would be quarantined. And that would be the same for teachers. If a teacher starts feeling ill on Friday, Friday morning they wake up, they don't feel well, they call in sick to work, and then they later test positive later on a Friday, we would back up to Wednesday and we would analyze their schedule, any students that they tutored, any small groups that they did, and if they were less than 6 feet away from students for 15 minutes or more, those students would be quarantined. Also, important to note, especially for sports, physical contact is automatically close contact. So any kind of touching is close contact. I also want to mention at this point that everything that I've shared with you right now is on the CDC website. What I'm sharing with you is not Hillsborough County Public Schools rules. It's not something that I created. It is exactly from the CDC website, almost word for word. And so you can Google who needs to quarantine CDC, and you will see exactly what I'm sharing. They also have some really neat calendars which show you and teach you how we count the days of quarantine and isolation, but I will also share that with you. So how do we determine close contact? It goes a little bit deeper than just, were you less than 6 feet away from somebody for 15 minutes or more? We gather seating charts. At the elementary level, this includes electives, lunch in middle school and elementary school, bus seating charts, and seating charts that we have for on-campus after-school programs like HOST or YMCA. We also will interview our positive adults, students, and parents to gather information about things that we wouldn't know that happened outside of the school day. For example, competitive cheer or AAU baseball or things like that that we're not aware of. We would ask about those activities because sometimes our students participate in those together. And again, quarantine decisions are based on the CDC criteria, and our Department of Health Hillsborough is right here, and they provide feedback where necessary. So the seating charts are analyzed based on the layout of the classroom. Sometimes principals and COVID leads will go in and remeasure to make sure that we're being as accurate as possible. Those seating charts are marked up, they're scanned, and they're emailed to a COVID team member. So that's myself or Mrs. Kemp or Ms. Martinez. And then they're shared with the Department of Health Hillsborough as necessary. Each school then makes a list. They put the positive student or adult at the top of the list, the name, date of birth, contact information, and the last time that they were on campus, and any people needing to quarantine students or adults as a result of direct contact with that positive case. They list that underneath on a spreadsheet or in a Word document, and then this is shared with the Department of Health Hillsborough as soon as possible. As soon as possible. And then that's what they use to do their investigation. So if your child has been quarantined, or if your child has had to isolate, because isolation is what we refer to when we're talking about a positive person, they participate in isolation, and an exposed person participates in quarantine. The Department of Health got that information because we are required by law to share that with them, because we are in the midst of a public health issue, crisis, if you will. So they use that to conduct their investigation, and during the course of their investigation, they will conduct additional contact tracing. Sometimes they alert us to additional quarantines that need to happen. Sometimes there's a sibling that goes to a private school that we're not aware about, so they will alert us that there's an additional quarantine that's needed, or they alert us to something that maybe the parent forgot to share about the onset of symptoms, and quarantine or isolation dates are adjusted as a result of the Department of Health, their investigation. So after those quarantine decisions are made, what happens? So the close contacts, the people who are exposed, are quarantined for 14 days from their last exposure to the person, and they are sent home immediately. So this is a little confusing sometimes, because if a student started having symptoms, let's say on Tuesday, and they stay home and they don't get tested until Friday, but they've been out from school since Tuesday, we back up to the last exposure. So if their last exposure with the rest of their class or with their friends was on Tuesday, even though the students were in school, their first day of quarantine started on Wednesday. So let me just say that one more time. The last time that a positive student was on campus, that was their last day of exposure. So even though sometimes several days have passed until we get notification that the student is positive, when we back up the 48 hours before symptom onset, and even if they're not on campus, that is when day one of quarantine starts for the exposed people, whether they're adults or students. Okay, so this was actually a question that somebody asked what happens next, the next bullet. There are times when family members cannot separate in the same house. So if a parent tests positive and they have a small child who cannot care for itself and they can't separate from the small child, the child who's been exposed to the positive parent will have to actually quarantine a total of 24 days. And I'm going to explain why. Another situation that would cause 24 days of quarantine would be if the household is just not big enough to separate. Sometimes in a household, siblings share rooms, or there's only one bathroom or two bathrooms in the house, and they can't separate properly. Separating means the positive person stays in a bedroom and uses their own bathroom and stays separate from the rest of the household. And when that cannot happen, the family members who are close contacts of the positive person have to sit out that person's 10-day isolation period, and then they can begin the 14 days of quarantine. Because every day that they're around the positive person, while the positive person is infectious, they are getting re-exposed. So they cannot properly quarantine until the positive person stops being infectious, which is 10 days. So it turns out to be about 24 days. So that happens a lot with our elementary parents, and they're often thrown for a loop about that. There's nothing anybody can do about it. It's nobody's fault, but that's CDC guidelines, okay? So a positive person isolates, again, for 10 days from the onset of their symptoms, or if they have no symptoms, 10 days from their test date. And then the last thing under what happens next, this slide, is if a COVID-19 positive person, a student or adult, has been on a Hillsborough County Public School site in the last 72 hours, I dispatch the environmental cleaning crew to properly clean the environment with the COVID-19 responsive chemicals. I know there's some great questions popping up, and I'm going to stop talking really soon, I promise. Also, if the student has been on a bus or uses ALC transportation, those vehicles are environmentally cleaned. Also, when a student or a staff member is discovered to be COVID-19, the entire school community receives communication with regard to the positive case. They receive either a verbal notification from somebody at the school over the phone because they have to quarantine, or if your student is not impacted, you might receive a robocall through ParentLink. And everybody knows where they stand, whether they had direct contact, indirect contact, or whether they had no contact at all, but we are just informing everybody to be transparent. The next thing that happens is that the school admin or COVID lead make a record of the quarantine or isolation in the student information system. And the purpose of this is to keep a record, and so the student does not get marked absent, because the student should not be marked absent during isolation or quarantine. Many students are able to do remote learning from home, and as long as they're active in remote learning, doing whatever work is shared with them, they are not absent. And then the last thing that happens, which I know is a juicy topic, and we'll talk about that in a second, is that the school admin lead enters the student or staff who is positive into an online reporting form which feeds the dashboard, the Hillsborough County Public Schools dashboard. Once they fill out that form, it doesn't automatically go to the dashboard. I review it, make sure that the information is complete, and I post it to the dashboard. The dashboard refreshes every day 4 times, at 7 a.m., 11 a.m., 3 p.m., and 7 p.m. So I know there's a lot of talk, or there were some questions, and I see a lot of talk on social media about the dashboard not being accurate. So you can see that there's a lot that school sites have to do in the response process. And the most important things are done first, and the things that are least important are done last. And filling out the documentation, like the online reporting form, is the least important thing. It's important, we expect it, it should be done, but it's the least important. The first thing is maintaining student safety and getting everybody home safely to begin quarantining so that we can keep everybody healthy. So this is done as schools are able to get it done, and I do expect them to get it done in 24 hours, but we do operate with a certain amount of grace because they have a lot of responsibilities in the school. Student safety and student learning are first and foremost, and so we give them grace when it comes to updating the dashboard. So sometimes there might be a day that goes by that a parent receives a communication from the school that there's been a case, but the dashboard doesn't reflect it. So as long as everybody's getting their communication, we are being transparent and we are doing what we are required to do. The dashboard is an added feature, something extra that we do to show every school's data and every school's statistics, and we expect that to be updated. But again, we try to operate with some grace regarding that, and also being that I am the one that has to send it to the dashboard. If schools, we have a lot of administrators that work late, sometimes 1 o'clock, 2 o'clock in the morning, and that's when I try to be sleeping. So if they post something at 3 o'clock in the morning to the online reporting form, I might not see it until I get to work the next morning, so it doesn't get updated until the 11 a.m. update. Schools and sites that are not listed on the dashboard have not had any cases. And we know that because if the parents didn't get any communication home, then we know that that's true, that they don't have any cases. I know there's lots of great questions popping up, and I am almost done. So answers to some frequently asked questions. We get phone calls up here in the COVID office and sometimes emails. And so these are some of the frequently asked questions. No, your student cannot take a test and test negative and then go back to school and end their quarantine early. So no person, adult or student, can test out of quarantine. And people will say, well, I know that nurses can do it, I know that doctors can do it, and my friend's job lets them do it. and that's every business, you know, writes their own protocols. We follow CDC criteria, and the Department of Health is in agreement with us that no person can test out of quarantine. Negative testing is not required in order for a student to return from isolation or quarantine. There's a reason. It's because many people will continue to test positive long after their symptoms have subsided and they are no longer infectious. So again, long after the 10 days of isolation, a person can continue to have enough of the virus in their body to test positive, even though they are not infectious and they don't have any symptoms. So we do not require a negative test to return to school. We would have many students and adults missing extra school and extra work if we required the negative test. And we know for a fact that they are not a detriment to other people around them. What's required to return to school is that students and staff must be fever-free without the use of medication for 24 hours prior to returning to school, and their other symptoms need to have improved. So just like, you know, the parents that are here in the audience that had children that went to daycare, they had to be 24 hours fever-free before they could return to daycare or elementary school. It's the same for all of our students and staff. 24 hours fever-free without using medication, and other symptoms have improved. And the reason that we have other symptoms improving and not completely gone is because there are some COVID symptoms that linger a really long time, like the cough. And so it is not necessary for them to be completely cough-free. They're not expelling any, you know, COVID per se with their cough, and everybody is masked. But the fever-free piece is really important. The third bullet, students, staff, and families do not need to quarantine due to secondary contact. So if one of your students is quarantined, you do not have to quarantine. Their siblings do not necessarily need to quarantine. The reason being is that they were not exposed to the positive person. Just the person who is exposed needs to quarantine. So if your daughter goes to Plant High School, I saw some Plant folks in the chat, and she was exposed, you do not need to quarantine because you were not exposed. You did not sit in that AP environmental class, so you do not have to quarantine. Testing, a lot of parents run out and get their student tested. I can tell you that my husband did the same thing. My student is actually on his second quarantine. He's a 7th grader, and I couldn't make my husband listen, but he insisted on taking him out to get tested right away. But the most accurate test result that you're going to get after an exposure is at least 7 days after exposure. Running out the day after an exposure to get a test is not always, is hardly ever accurate, because enough time has not passed for the person to develop symptoms or test positive. And again, I know I mentioned this in another slide, but people who have tested positive for COVID-19 do not need to re-quarantine or get tested again for up to 3 months, as long as they do not develop symptoms again. So now it's Q&A time. I see a lot of questions, and I'm going to try to add these in here, but it probably won't let me. So I am going to, oh, it will. So I'm going to type these in for the benefit of everybody who's going to see this presentation later. And because I know that they're going to be really good, juicy questions. And so Ms. Fullwood, if you want to feed me that first question, that would be great.
Yeah, and they're pretty long, so some of them are pretty long, but I'll get to the meat of the question. All right. So I'm not sure if you have the ability to answer this, because I don't, but can you confirm that e-learning options will continue past the first semester?
That's a really good question, and I don't know, but if you check your email soon, there will be a survey. It might already be out from the superintendent to gauge everybody's intent for January. I believe we are still waiting on our state, our State Department of Education to let us know what is going to be permissible. with regard to students and their choice for education beginning in January.
Okay. With one of my children attending the school with the highest rate for student positive cases, now approaching or almost 50, I am significantly concerned about the lack of district planning for instructional time for quarantined students, and students having to quarantine more than once. I know you just talked about your son, Jennifer, having to quarantine twice.
Yes.
So I've asked academic services, emailed the school board member, and the response has been incredibly insufficient. It does not take into account mandated instructional minutes or student success. As this gets worse rather than better, what is the district's plan for multiple quarantines, students and employees?
So our district monitors, and I assist in that piece as well, our district monitors the percentages of students at each school and the percentages of staff at each school related to quarantines. And I do not know what the threshold is, but I can tell you that there is a threshold that if it's reached with regard to student or faculty quarantines, in other words, not being able to be in the building, that the district has a plan to take action. What that looks like, I don't know, because we haven't gotten there yet. We haven't gotten to the point where instruction could not take place in a building because there were too many students missing or too many teachers missing. The first part of your statement about instruction, I believe I remember speaking to you on the phone, maybe not, but I do know that the instruction provided to quarantining students is ever evolving. And I think that many parents thought that students would just be switched over to e-learning when they were quarantined, but e-learning was set aside for students who picked that as a learning platform. So instead of doing brick and mortar, they are e-learning. So there isn't always the capability to move students to e-learning, especially in the high school level, because the high school teacher that e-learns already has a full roster. Now, sometimes in elementary school, there have been times in elementary school where we have had to quarantine an entire class due to small group instruction or whatever the circumstances were. When the quarantine tracing was done, everybody needed to quarantine, including the teacher. And so in that case, the students were able to e-learn with their own teacher for the 14 days of quarantine. I do believe that the remote learning, because that's really what's happening for the quarantine students, it's not e-learning, it's remote learning. The remote learning opportunities are a challenge for students and teachers, but I do believe that the more we do this, the better it's getting. For my personal child, I can tell you that he has a lot more work to do and a lot more relevant work to do than the first time that he quarantined, which was earlier in the school year. And I think that it just took practice and it took some acclimation for the teachers in order to be able to juggle both things, in order to be able to lesson plan for the classroom and lesson plan for students and post assignments to Canvas. I do think that the best thing we can do for our students is communicate with the school and to not feel as though we're being a pest, but to continue to communicate and continue to push and to follow that chain of command. And if after messaging the teachers, you need to elevate it, then you need to elevate it. That's your right as a parent.
All right, thank you so much for that. This next question is in regard to class size being increased, and as more students return back to brick and mortar, how is there a plan for this being addressed by the district?
So the district has been really open from the beginning that we were going to do the very best that we could with social distancing in the classroom, but that in most cases, it the students will not be able to be 6 feet apart. So as we bring students back in the classroom, our mitigation strategies are still in place. There are still directional signs to keep students from, from walking in certain exits and out certain exits. There are still arrows in the hallways to try to guide traffic in certain directions. There's still sanitation and cleaning protocols in place. We still will continue to have mask mandates in our schools, and we will social distance as best that we can in classrooms. Teachers long ago removed any furniture that wasn't essential in order to make as much space as possible, and schools are doing a phenomenal job trying to schedule their students so that classes are level and are balanced. So to answer your question, we're going to keep on doing the same, the best that we can. And we're going to continue to reach out to parents and educate our community about things that the community can do to support us in schools. Because we're seeing, to be honest with you, that most of the spread is community spread. Have there been students who tested positive because they were exposed to other students in school? Sure. Have there been teachers that were exposed to other teachers and tested positive? Absolutely. But the vast majority of the spread is happening. It happens in households. It spreads very easily in households. So typically when there's a positive parent, the rest of the family is going to test positive at some point. Not always, but sometimes. Often, I guess would be the best word. And for our teenagers and our middle school students, what they're doing outside of school socially has a huge impact on, in my opinion, contracting COVID-19 and then coming, and then of course they attend school. So the best thing that parents can do with regard to class sizes getting bigger is to continue to push the mitigation strategies with your students and continue to ask questions and support.
Okay, thank you for that. This one has to do with teachers, and when teachers are quarantined, what is the plan for substitutes when teachers are having to be quarantined?
So as you may know, we contract with Kelly Services to provide our substitutes, and they're doing the very best that they can to provide us with as many substitutes as possible. In some schools, paraprofessionals that assist in the classroom are able to take over classroom instruction. And at times when a teacher has to quarantine due to exposure, but they feel really well, I know that there are elementary schools that have the teacher on the board Zooming from home and teaching the class from home while the paraprofessional, for example, supervises. And the same thing with substitutes. There are many times that a teacher who is quarantining due to exposure who isn't necessarily symptomatic provides instruction remotely from home while someone in the classroom supervises the students. There is no easy answer to the question with regard to substitute shortages. There just isn't. Just as many people are nervous about contracting COVID, many people who would maybe be substitutes are nervous as well, but we treat them as employees, we temperature check, and we provide them with the same safety protocols that we provide all of our staff to give them a sense of security.
All right, awesome. This next question really was, will Hillsborough County release quarantine stats? And I believe you covered that in your presentation.
The only thing I will add is that quarantine stats are a moving target. So one day a school might have 5% of its students on quarantine, and the next day they have 1%. Because as students are coming on, getting on quarantine, students are getting off quarantine. So it's not a super easy number to nail down. I will share with you, since you asked that while you're on the phone, I'll share with you our current situation. Since you're on the phone, since you're on the computer, our current situation is right now that we have 3,000 students, a little over 3,000 students who are impacted. They're either in isolation or quarantine. Most are in quarantine. And we have a little over 200 employees impacted. So for the benefit of this group, since you joined me tonight, I can share that information with you. But again, as of tomorrow morning, there will be a bunch of students and teachers returning from a quarantine or returning from an isolation, and so that number changes.
And that dashboard, is it available to the parents, correct, on our website?
Right, the Hillsborough County Public Schools dashboard is absolutely available to, I'm going to show it right now. It is available to everybody to see. So this is the dashboard that is available on the school district website, and you can see how many cases per day. You can click on this little chunk and it's going to show you if it's working. So when I clicked on this little blue piece, this is the students, and these are the schools that had students today as of right before I started the webinar, because there might have been somebody that entered a case since I've been working with everybody on the webinar. So after I get off, if I can make the 7 o'clock deadline, it will update again. And then this little piece down here are the employees. So this is where employees tested positive today. And again, keep in mind that if they reported to their principal yesterday that they were positive and the principal typed it in today, it's going to reflect today. So hypothetically speaking, if your student goes to East Bay High School and you got a communication last night that an adult tested positive, but it's showing on the dashboard for today, it's because that's when it was entered, and it's the same case.
Okay, so that's another one that was coming up. What is the average timeline from when you are notified until notification is given to the school?
So what is the average time for when I'm notified?
That's what it sounds like, yes. Versus, or maybe them, maybe the parent versus the school. I don't know, but you can.
Okay, so let's talk specifically about timeline. So when the school gets notification, so the school getting notification is really dependent on the parent, right? So as soon as the school gets notification, they will reach out to me. I am on duty 24/7. I have a district cell phone number, and I receive calls or text messages 7 days a week. Again, I try to be asleep at 2 a.m., but if there's a catastrophe and I get a call at 2 a.m., which luckily so far I have not, I just knocked on wood, for those of you that are superstitious, I will answer the phone. So they notify me immediately of a positive case. And then they go through all the steps that I shared with you, and then and parents are notified the same day, unless they get notification at like 10 o'clock at night, then they'll notify parents the next day. Now, sometimes the Department of Health notifies us of a case before the school knows. So as soon as the Department of Health notifies us of a case, we notify the school. And sometimes that's on the weekend. So I'm intermittently checking my email for emails from the Department of Health, and they'll say, hey, this student at Brandon High School tested positive yesterday, and I will reach out to Brandon High School, and they'll either say, yes, we know about it, we were just about to call you, or they'll say thank you, and we'll start the quarantine tracing process.
All right, awesome. All right, this next question is, what do I do if one of my kids has cold symptoms without a fever?
So cold symptoms by themselves are not enough for your student to have to stay home. And I'm really glad that you asked this question. So thank you so much. There are some symptoms that are deal breakers as far as going to school. And we've raised, if you're raising your children from babies, you know what those are, right? Diarrhea, vomiting, and fever. Those are, do not pass go, do not collect $200. They cannot go to school with vomiting, diarrhea, or fever. Okay, cold symptoms by themselves are not necessarily enough for a student to need to stay home. I respect parents and appreciate parents who decide to keep their students home and get them checked out with cold symptoms. Sometimes cold symptoms are all they get, and they do test positive. So we do not require students with only cold symptoms to stay home. If they come to the clinic and they have like I said, some of the heavy hitters, fever, vomiting, diarrhea, body aches, respiratory issues. Those are symptoms that the school nurse is going to ask you to not bring them back until they're seen by a physician.
Thank you for that. All right, this is a good question. I see some of the questions, they have already been answered, so I wasn't going to ask again, but this was a new one. It's about if a parent or household member of a student has symptoms, and they put after a known exposure, and then goes to test for COVID, should that student enter into quarantine at least until the test results return?
You know, we really appreciate that. It's not required, but we really appreciate it. If there is a symptomatic member of household, and if you are getting that member of household tested, we really appreciate if you are able to keep your student home and let them do remote learning until you get those test results back. And you bring up an excellent piece that I neglected to emphasize until now, but I'm going to emphasize it pretty heavily. And please share this with your friends, your friends at church, your friends at yoga, your family members. If you get your child tested, if your doctor says your child should be tested, or if you get the urge to get your child tested, please do not send them to school until you get the results. A lot of parents, symptoms will start, they'll get their child tested, and then boom, the symptoms are gone, and they're like, it was nothing, go to school. And then while they're at school, you get the email that your child tested positive. So we really appreciate any time that there is a pending test result, either for a family member or for a student, especially if symptoms are involved, if the student could stay home until those results come back. Now, you know, we don't want them to stay home for 2 weeks waiting for test results. But nowadays our testing, at the most, it seems to take 3 to 4 days at the most. So thank you for that question. Yes, please, pending test results, especially the students' test results, a symptomatic student, please let them stay home until you get those back.
This is a good question. Does quarantine mean isolating person to a room for 24 hours, 7 days a week, 24/7?
Okay, so quarantining does not mean that. Isolating means that, though. So my son right now, who's quarantined for the second time, he's free to move about the house. The reason being is that he's not positive. So he can't infect me. He can't infect my husband. He can't infect his brother because he's not positive. He's been exposed, but by him being exposed, it doesn't mean that I'm getting exposed or my husband's getting exposed or his big brother is getting exposed. If he was positive, well, he's only 12, so I don't know that I would be able to separate from him. It would depend on how bad his symptoms are. Probably not. But let's take my 19-year-old son. As a 19-year-old, if he was positive, he would isolate because he's positive. Isolation is for positive people. I would put him in his bedroom. I would move my other son to a different space of the house because their rooms are right next to each other. And my positive son would stay in his area of the house and he would use a bathroom by himself, and I would drop his meals in front of the door. And he would not go any place other than his room or the bathroom. That's what we mean by separating in a household when somebody's positive.
Oh, thanks for that. That's great clarity. All right, this question goes to regarding coming back, returning to school and not having to test negative. The question was, did you say that that's aligned with the CDC guidelines, or is that a Hillsborough County Public School guideline?
It's not a Hillsborough County Public School guideline. We don't create guidelines that are health-based. All of our guidelines come from the Department of Health, Hillsborough, and the CDC.
Thank you for that. Okay, the next question says, my daughter, Okay, so my daughter is at Plant High School in e-learning. How can I find out how many students are at Plant High School to have the percentage of people who tested positive? and the percentage of the students who have been quarantined. Okay, that's basically what you're showing there on the screen. I'm sorry.
So she can see how many students. So there have been 31 students so far and 6 adults. And let me see. I think there's a place that you can look up the total number of students at a school, but I can just tell you, I mean, it's public information how many students are enrolled at a school. So right now at Plant High School, there are 1823. 1823 is the total enrollment there right now in the building, brick and mortar. That's not including e-learners.
All right. This next question is about the COVID cleaning protocol and who is in charge at each school.
So the daily, so there is cleaning that is done, maintenance cleaning that is done between classes where teachers assist in wiping down using wipes or spray that's provided in between classes or in between activities. But the custodians in our schools are the ones that conduct all of the regular cleaning, just like they always have, except now it's a little bit more in depth and they're using special chemical, I hate to say chemicals because that sounds so scary, but separate special cleaning sprays that were purchased because of their ability to combat COVID-19 on surfaces. So they do all of the same cleaning and then a little bit extra, a little bit more focus on surfaces, doorknobs, walls, places that little kids run their hands. Extra cleaning is done on tables, in bathrooms using the chemicals. So, and then of course, if we have a COVID positive case, as I mentioned, the environmental cleaning crew comes in and they put on the suits and they spray with the special spray that has to sit and dry and then be wiped off after it dries. So that's essentially the cleaning. You know, our students are using hand sanitizer like it's part of their everyday regimen now, so that's really refreshing to see. So that's an important mitigation strategy besides the cleaning that happens. And our teachers have just been doing a phenomenal job. If you talk to elementary teachers, they're like, it's no big deal because they were used to Clorox wiping everything anyway. But of course the stress is a little higher, and so we appreciate everything our teachers do in between classes to keep our students healthy, and of course we appreciate our custodians.
Awesome. All right. Someone mentioned about you mentioned about 3,000 students have been impacted. So she was like, she loves the dashboard.
No,
could you also see the impacted number? How many have been isolated because of a potential exposure?
So we don't have it broken out like that. So I don't have positivity versus quarantines. Like I don't have isolations versus quarantines. I can just tell you today, that number I gave before, a little over 3,000, is just today. Okay, just today, as of right this second, we have 3,000 students isolating or quarantining. That's not to date, that's just today. So, well, I forget what the original question was, Ms. Fullwood. Get me back on track here.
Okay, so it says, I love the dashboard, but could we also see the impacted numbers on here? How many have been isolated because of a potential exposure?
How many have been quarantined due to, yeah, because quarantining is what we do when there's been an exposure. Mm-hmm. I don't know. I would say on average for a high school exposure, we probably quarantine 25 students, 30 students. For an elementary exposure, sometimes it's 12 kids, and sometimes if small groups have been being conducted, because that's best practices for instruction, sometimes it's the whole class. and middle school is about the same, but I don't have a district statistic for quarantines versus isolations.
Okay. I know you went over this, but I guess it should be repeated. What is the timeline for the quarantine tracing process until those who have a quarantine are notified? Sounded like 24 hours. Is that correct?
It's way less than that. It's the same day. So, so for example, if a student's parent called the school this morning at 9 a.m. and said, my student tested positive yesterday on Sunday, those students who are quarantined, they know within a couple of hours, and their parents are called to pick them up.
Okay.
The only time it might take a little longer is if we get notification at 10 o'clock at night. Sometimes the parents take the child to urgent care after school to get tested. You literally will sit in urgent care for 5 or 6 hours. I joke with you not. Trust me, I was there last week with my son who was quarantined for the second time, except this time he was 7 days past exposure because my husband listened to me. And then if they don't get home from urgent care until 10 o'clock, they reach out to the teacher, let's say on Remind or something, and they say, I'm sorry to bother you so late, but Johnny just tested positive. At 10 o'clock at night, we're not going to start the quarantine process. It's just not feasible.
Okay, this is a good question. At our school and in kindergarten, students' desks are grouped into small groups. Oh, Lordy, I lost that question. Okay, here we go. Into small groups from 4 to 6 desks, all facing each other. In this case, is a student in one small group tested positive, would the whole class be quarantined, or would just the small group with the positive students be quarantined?
That really depends. That's a great question. That really depends on how much space is between each cluster of 4 desks. So some schools have chosen to do that in order to minimize the amount of students that need to quarantine if one of them tests positive. So if by putting the groups, the desks together in a cluster, they were able to keep the clusters 6 feet apart, then only the students in that cluster or that group of 4 would have to quarantine. If the next cluster to the right or the left or in front or back is at least 6 feet away. And that's exactly why some schools decided to set up their classrooms that way. I mean, it's just, it's just statistics. Like it's kind of playing the odds, and it's lessening the exposure for most of the class. So to answer your question, if the next cluster of students is 6 feet away, the next group of 4, no, they wouldn't have to quarantine. But again, we don't just go based on the classroom, okay? We go based on lunch, we go based on specials, so we have to look at a lot of different seating charts and a lot of different arrangements before we make those decisions.
Okay. My child is currently quarantined. We have had her tested and she is negative. We stay home regardless. Say she develops symptoms after that negative test. Does that begin her quarantine period all over again?
That's a great question. So if, God forbid, her symptoms start tomorrow, okay, tomorrow's Tuesday, she will then become an isolating student. Okay, and tomorrow would be the first day, if her symptoms start tomorrow, which is Tuesday, her isolation starts Wednesday, and she would have 10 days of isolation. Okay, so the day after symptoms start is day 1. Okay, if they have no symptoms, but they test positive, the day after they take the test is day 1. If they've been exposed to a positive case, the day after they were exposed for the last time is day 1 of 14. 10 days for a positive, 14 days for an exposure.
All right. This is a good question about if the spread is in households so easily, why do you not isolate the sibling of a person who's pulled out for direct exposure?
So because the exposure has not tested positive. when I mentioned that it spreads in the households pretty easily, that's when somebody in the household is positive, it spreads. We don't have a lot of evidence of students who are quarantined due to exposure bringing it into their house and spreading it that way. Usually it's when we have a confirmed positive case already in the household that it spreads. So if the student tests positive and they're living in the house and they're not able to separate, if a parent, contracts the virus, let's say from work or from some outside place, and is in the household and they're not able to separate, that's when it spreads. Not secondary contact as much. Does that answer your question? I want to make sure that I was clear.
All right, well, if they come back on to
Okay.
ask, this one has, does Hillsborough County make its own decisions regarding mask requirements, or are they at the mercy of the county commission and the state mandates? Does
Nope.
Okay, go ahead.
No, we are absolutely doing what's in the best interest of students and teachers in our schools.
And does your criteria for quarantine change for a child that has a medical note to not wear a mask?
Nope. If we have a student who has a medical reason not to wear a mask, remember, the quarantine criteria doesn't say anything about masks. And I know the next question is going to be, well, why do they have to wear them? I'll tell you. So the quarantine criteria is less than 6 feet for 15 minutes or more, irrespective of wearing a mask. Those are the CDC's exact words, irrespective of wearing a mask. So then the next question is, well, why do they have to wear a mask? Because it's just good common sense. Masks, regardless of what they're made of, filter out 30 to 60% of respiratory particles. So wearing a mask is just a really good mitigation strategy. It just makes really good sense. So that's why we wear masks. If we didn't wear masks, I wonder, how much the spread, would increase. I don't know. I mean, I'm not psychic and I'm not a doctor. I have read a lot and I've gotten a lot of great training from the Department of Health on the job. So I know a lot about mitigation strategies and how to respond to COVID. But I think that the mask wearing is really important, and we are not at the mercy of any outside organization.
Okay. I think that is all.
I saw something posted about that's an impressive timeline. I'm always fishing for a compliment. Thank you so much, Lena. I really appreciate that. Yes. Please give your schools like some thumbs up. As hard as I work, they're working even harder. Please remember and please consider that teachers they signed up to teach, and administrators signed up to be administrators and to supervise teaching and learning and make sure that our schools are great. And there was no preparation for this. People, I'm going to shoot from the hip with everybody here because I feel so comfortable with all of you. There are lots of critics out there and they like to say, oh, they didn't have a plan. They didn't have a plan. There's some things that have come up that you just couldn't plan for until it happened at least once, and then you knew how to respond properly. You could sort of have a plan, but until you're actually in it, you just don't know what the best course of action is going to be, what's going to be the best for students and families, what's going to be best for teachers. So just keep in mind that our schools are doing an amazing job. They're trying to help students learn, and they're also trying to keep students safe, and they are trying to contend with COVID. And every time there's a COVID case on campus, it takes up a minimum of 3 hours of somebody's time to handle it from start to finish. And sometimes it's multiple people. And that's not a criticism. That's just how long it takes to do a really good job and make sure that everybody is as safe as possible. So please share that with your communities. And I want to show everybody the last slide of my PowerPoint so that you can see where the heck did it go?
Someone, Jennifer, I just want to give you
Yes.
this compliment. This is thank you for your answer regarding masks, Jennifer. You are very articulate, and I vote you for superintendent.
Oh, thank you. Thank you so much. I don't think he's ready to give up that job yet, but I do appreciate that. I really do. And that's just, some things that I've shared have been very factual, but the mask thing is I feel very strongly about. So if you have questions after the fact, I didn't do a very good job taking notes. This is an email address that comes right to me. It's covid@hcps.net. covid@hcps.net. You can always email me, and I will get back to you as soon as I can. And there's no question that's a dumb question. And please read the CDC website. I invite you to do that. I invite you to vet anything that I've shared with you. You will see confirmation for things that I've shared. And if you don't find it, email me and I'll show you where it is. And again, thank you, parents, for being open and for communicating and for being supportive. We couldn't do it without you.
And I thank you, Jennifer, for taking out your time. I know you're very busy, but and I know you wanted to share this information. And so I do so much appreciate you. Thank you, parents, for your great participation, your great questions. I have also learned a lot about our protocols, so I'll be able to answer some questions too from now on. Thank you so much. And I hope everyone has a great evening.
Thank you, Mrs. Fullwood.
You're welcome. Good night.
Good night.